Is to feel for the rhythm. So you're going to feel for the rhythm with 5 grams of pressure. I'm going to do just a short version of it so you can have an idea. So you look for the synchronism, you're looking for quality, amplitude, rate, the rhythm in general. After you get that, you're going to put your hand on the back of the head, the other one on the frontal bone, and you're going to feel for the rhythm. Also, I'm going to exaggerate a little bit with my hands. It's going to be like this motion, and you're going to feel for it. Look for the same qualities that I just mentioned in the beginning. Then after that, you're going to go to shoulder region. You can see my fingers are pointing down. Then you feel for that movement. And I'm going to exaggerate the movement so you can know what I'm talking about. This is the movement you're looking for. And you're looking for synchronism, you're looking for amplitude of flexion and extension. After you get the rhythm here, then you're going to, I try to avoid the rhythm in here for the fact that it gets confused with breathing. So you're going to go to the ASIS, you're going to feel the rhythm, and the rhythm, as I am exaggerating the movement, it's going to be this rhythm here you're looking for. After you get the rhythm here, looking for all the qualities on the rhythm, then you're going to go on the thighs, and the same thing will be this rhythm you're looking for. After here, you're going to go to the ankles. And here it is. You're going to have the lateral malleolus attached to this part of your hand. And you're going to have to feel for the same quality and rhythm and synchronism on the flexion and extension. I'm going to exaggerate a little bit the motion so you see what I'm looking for. I'm looking for this motion, but with the 5 grams of pressure. After you identify where the problem it would be, maybe where you don't have the rhythm or something's out of sync, then you're going to do the CV4 or compression of the 4th ventricle. Compression of the 4th ventricle. I'm going to be with my hands like this, and I'm going to have the occiput laying on this part of my thumb here. So I'm going to go under, and my hand is going to be underneath here. I'm going to feel for the rhythm, flexion and extension. When it goes back out into flexion, I'm going to resist and not allow that to open and go into flexion until I feel that the system is stopped pushing against my thumbs. And then when that happens, the system went into what we call a pause or a still point, which is a healing point or a healing time. I'm going to remove my hand from underneath her arm so you can see the position on my hand. And that was this position. Okay. So after this still point, I am going to do the lumbosacral release. And I'm going to put the hand here. I'm going to put my hand under the sacrum. For that, I'm going to have to roll her sideways a little bit, put my hand under the sacrum, let her rest. Put this fingers here on the lumbosacral, and I'm going to grab the spine like this. Right there. From here, I'm going to slide my left arm down as I'm dragging the sacrum down. And that is more than 5 grams, about 7 or 8, maybe 9, as I'm stretching the lumbosacral region. I don't force, I don't go too strong, but I don't go too light either. Enough so I can feel the body sliding on my hand here. It's sliding her lumbar towards me. Can you feel it?
Mm-hmm.
Okay. After that, I'm going to remove my right arm out. Here's the ASIS. Here's the other ASIS. I'm going to put an elbow here. Grab the ASIS on the other side. I'm going to compress medially. I'm going to exaggerate the motion. This is what I'm going to do. Okay, with 5 grams. And then I pay attention on the hand that I have underneath where her sacrum's resting. Feel for movement of the sacrum on the palm of my hand. Feeling for the sinking of the sacrum on my palm. After that, I release the pressure. Remove my hand. Then I'm going to go into the diaphragm releases. First one is the pelvic diaphragm release. For the pelvic diaphragm release, my hands are going to be like this. Pressure is going to be from the top part of my hand down to the bottom hand. So I'm going to put my hand right across here, the bottom hand, under the sacrum there. This hand is going to go the pinky side, right here, across from the other hand, and I'm going to apply 5 grams with this palm down. The time that you do the diaphragm release varies. It depends on you. You can do that for a minute, 2 minutes, 5 minutes, half a minute. It all depends. Pay attention for the movement of the body and the tissue on the hand that is underneath. You feel sometimes the body moving and rotating. After the diaphragm release here on the pelvic region, we're going to go to respiratory diaphragm release, which I'm going to remove both hands. I'm going to put my hand right across from the diaphragm area. I'm going to find where the ribs are. I'm going to put this finger over the rib and the thumb over this rib. I'm going to apply 5 grams straight down toward the bottom hand. That is the respiratory diaphragm release. The next is going to be the thoracic inlet release, which I'm going to take her arm back down. One hand's going to be underneath, right across from this area, under. The other one's going to be right over, one finger over the collarbones here on the left side, on the clavicle, another one from here on the opposite side of the clavicle. So I have my hand here, and then one on the clavicle, another one on the other clavicle. I'm going to apply 5 grams with this straight down. Remember, I'm doing a short version, so the time that you just spend in each of those areas is up to you. After that, you're going to go to the hyoid release. I'm going to have 2 fingers right across from here where the line is on the neck. And I'm going to have this finger and this thumb here holding on the skin and pulling the skin up. And then I'm going to exaggerate a little bit what I'm going to do with 5 grams. So I'm going to do this motion, pull it up, and I'm going to move this way, and then back to the center, back this way, back to the center. After I do that a few times, I'm going to go straight up. This is what I'm going to do with 5 grams. Now I'm gonna go to occipital base release, which will be here, the suboccipital region. And the way you do that is by getting the fingers, not the pinky, right at the suboccipital region. So the weight of the head's gonna lay it on your fingers. So I'm gonna go here with my index fingers where the mastoid process is, and I'm gonna put my fingers under and allow the head to rest on my finger. After the head rests for a little bit, you're going to feel that the fingers are sinking into the suboccipital region. And you're going to go one right side up, left fingers down, left fingers up, right fingers down. And you're going to do that a few times. And then you're going to stop and let it sink a little bit more. And you're going to put your pinkies right at the base of the occiput. And you're going to pull the occiput towards you. Only with your pinkies. That is the occipital base release. So now we're going to go into the cranial bone releases. First one will be the frontal. So you got to go all the way to the very edge here. Don't pass this. So basically looking to the corner of the eye and put your finger, your third one here, your ring finger right at the edge. And you put pressure with those ring fingers, 5 grams onto the skin, and then lift. And I'm going to exaggerate that. 5 grams in and lift. Once again, the time that you just spend on each of those, it's up to you. Or sometimes up to the body. The body tells you, I need a little bit more time, and moving your hands to different locations. I'm not free yet on the right or left, and I need you to spend more time waiting for that release to occur. After the frontal release, I'm going to go to the parietal release, which is going to be a parietal compression and then the release towards me. So I come here, go under the hair, find a little edge where it rolls over into the temporal. Before it rolls over, that's where I got to stop with my fingers. So I do a medial compression and then drag the scalp with 5 grams towards me. Next will be the temporal bone. On the temporal bone, I'm looking for the mastoid processes on both sides. And I'm going to put my hand like this, and I'm going to feel with my thumbs. So I'm going to look for this motion of the mastoid process, or if you're already out of synchronism, if it's not, I'm going to put out of synchronism by holding one side and let the one out. And then hold this one in, let the other one out to be under, will be out of sync. So the head is resting on my palms here. Now I have my thumbs on the mastoid process, and I wait for the cranial rhythm. After I have the flexion and extension, which I have now, it's in sync, I'm going to allow that to go into extension. Well, going in here, I'm going to hold one side, the right side. I'm going to allow the left to come out. So when I hold the right and let the left to come out, I'll put the temporal bones out of synchronism. And then when I continue to do this motion out of sync, I will push it in a little bit more when it goes in to stretch the suture between the temporal and the parietal. And the temporal and the occipital. So it's still out of sync, and I'm going to let go. I'm going to do the circumferential finger on the ear, which my ring finger is going to be at the mastoid process. My third finger is going to be in the ear. This one's going to lay right over by the zygomatic arch, above the zygomatic arch. I feel for the rhythm again, and I'm going to exaggerate the movement. This is the movement I'm going to go for with 5 grams. So after that, I got the rhythm. I'm going to rotate the occiput, still out of sync, back and forth. After one side goes in, I'm going to hold this side, not allow them to go back out. And I allow the right side, in that case, to go back in. And then I wait and allow both sides to come back out. So it's back into synchronism again. The next is going to be the ear pull. We're stretching the ear. With that, I'm going to hold the ear like this. So my thumb is going to be here. And this is the motion I'm looking for, towards the shoulder, with 5 grams. It's always good to pay attention to how easy one side is than the other to be stretched. Sometimes, like in her case, the left side doesn't go very far. I can feel the resistance on the left. The right side is stretching a lot easier. Now the left side is stretching. Wasn't stretching. Now it is. But it's keep moving. The ear is rotating back and forth, back and forth, back and forth, and then stretching now. I'm going to do this sphenoid compression and decompression, which I did out of the sequence that you have, but you can do that in sequence or out of the sequence. So the compression is, I'm going to put my thumbs on the skin, and I'm going to do this motion for compression. Then I'm going to relocate my fingers, or my thumbs, and I'm going to do a decompression upward. So this is going to be a compression of the sphenoid, 5 grams down. After that, take my thumbs here, I'm going to put down, I'm going to decompress upward, moving my thumbs towards her eyes. That is the decompression. After this one, I'm going to do the TMJ compression and decompression. I'm going to look for the arch of the mandible here. I'm going to put my third finger right at the arch of the mandible, and I'm going to do this motion, which is compression, with 5 grams. After you do that for a little while, then you're going to take your fingers out of here, you're going to put above the arch, and you're going to do a decompression with 5 grams. Once again, pay attention if the left side moves more than the right. The one that doesn't move as much is not stretching or resisting, or is resisting to your light stretch. You just stretch a little longer. Okay, now I'm going to go to the sacral duotubal rock and glide. So I'm going to move here. I'm going to put one hand under the sacrum, one hand under the head, and after I get the motion, I'm going to feel for this rocking motion on the sacrum. Then I'm going to stop one, and I'm going to glide this one. I'm going to stop this one, I'm going to glide this one here. Then I'm going to stop and allow them to rock again. So one hand under the sacrum, one hand under the head and pay attention and wait for the rocking. It's going up that way now. Now it's going down towards my other hand, my left arm. And back up to the head. I'm going to hold the head now. Then when it goes the center down, I'll stretch that. I'll glide that a little bit more. And I'm going to do it again. Come back up. Going to glide that a little bit more. Now I'm going to let her rock a little bit more. I'm going to hold the sacrum. I'm going to let the head go up. And I'm going to glide. Back down. And then glide. Now I'm going to wait. I'm not going to hold it either. I'm going to just put a rest on my hands and allow that to rock. Now I'm going to glide both sides. The way I glide both sides is I hold the sacrum, don't let it move, and I stretch my hands away from each other. So basically, I'm doing this at the end, stretching the whole entire spinal cord. As I'm done, I'm going to do the compression of the fourth ventricle again, or still point to finish. Hands here, and let the occiput rest on the web on my thumb. Wait for flexion and extension. Stop the flexion, don't let it go out until it stops pushing against your thumbs, and go into a pause. After that is done, then I will allow that to open back up again. And the rhythm should be stronger, more powerful, should be back into synchronism again. And then you can go back and check again for the rhythm after you finish. You can do a little check here and go back to the ankles and check the